cold air, the seasonal changes, less vitamin D from sunlight exposure, more dehydration, the high sugar holidays that contribute to a weakened immune response as well. Hi, I'm Dr. Jinmee Graham. Welcome back to the channel. Today we'll be talking about colds. Specifically, why do we get colds, especially in the colder fall and winter months? Is cold and flu season really an inevitable season that affects us all, or are there deeper factors at play here? Today we'll be touching upon more of a terrain theory perspective instead of the conventional germ theory perspective. But my hope is that by the end of the video, you will begin to see colds as a wise adaptive mechanism of the body to try to keep us healthy and well instead of a seasonal inconvenience that we just have to deal with. So jumping in, what is this germ and terrain theory all about? So essentially the conventional approach to looking at colds or any other symptom or ailment is to take on a germ theory perspective. And that is primarily the perspective that just simply exposure to a pathogen, a germ, a virus or bacteria is enough to get you sick. And if you're experiencing a cold, the cause of that cold are, of course, those typical common cold-causing viruses, such as rhinoviruses or coronaviruses. However, if this was really the case, then why can a room full of people be exposed to the same virus or bacteria or pathogen, but not everybody comes down with cold and flu symptoms or gets sick? This is where we want to dig a little bit deeper and look at the terrain theory perspective. Now, terrain theory looks at what other factors are at play that contributes to how the terrain of our body, our internal environment, looks and how well it functions. In this theory, if our internal terrain is healthy and functioning well and has the components it needs for optimal health, then it can keep these pathogens, these viruses and bacteria in check without them overwhelming the body. However, when our internal terrain is compromised or imbalanced, then this can lead to those viruses or bacteria, which are opportunistic infections, to take hold and wreak havoc on the body. And this has a lot to do with our susceptibility. So that's what we'll be looking at today with regard to the common cold. So first of all, let's talk about how cold weather influences the body and our potential susceptibility. So in climates where it does get colder in those fall and winter months where we typically tend to get more colds and flu, and we call it cold and flu season, one thing that happens here is when the cold air hits our nasal passageways, this can temporarily inhibit something called mucociliary clearance. And this is the mechanism of the body that tries to expel any gunk or toxins from the body up and out through the respiratory tract and through the nasal passageways. However, when this is impaired through the cold air, then this can allow an opportunity for some of those opportunistic viruses to persist because they're not actively being cleared away through this mucociliary activity. In addition to this colder air, the air also tends to be drier with the lowered humidity, and this causes the mucus to become thicker and harder to transport. And this can lead to a situation where now you're really congested and you're not actively or properly expelling what you need to, and things are just getting really uncomfortable. Not only is this increased congestion uncomfortable, it's really important that things are flowing and thin enough to flow and move properly so that we can do what the body's trying to do and get and expel those components up and out of the body instead of just staying there, getting stuck, and potentially causing more problems later on. In addition to the cold weather, we typically have less exposure to daylight or sunlight, and with that, a consequence is lower levels of vitamin D. And as we know, vitamin D is a crucial component of the immune system and how well it functions. It keeps inflammation in check, it modulates the immune responses, and makes sure that our immune cells are working appropriately to keep us strong, healthy, resilient, and well. So you're beginning to see how these factors are adding up and adding to increased susceptibility to illness or some of these symptoms that are not as fun to deal with all the time. Now, cold and flu season, as we call it, tends to also occur around these high sugar holidays. So we have these holiday habits where we tend to indulge or increase our refined sugar intake and potentially are consuming more ultra-processed foods. So we have Halloween in October where the kids are eating a lot of candy from all of the pies and desserts in Thanksgiving, the Christmas cookies, and into the new year, Valentine's Day. And all of these holidays are culturally our high sugar holidays that we tend to consume more sugar. And as we know, high sugar intake also suppresses and dampens the activity of our immune system. If you want to dive deeper in this, my last video covers the effects of high sugar intake on the immune system, so feel free to check that out. Another component is dehydration. So typically it's easier to think about drinking and hydrating yourself when the air and temperature outside is warmer. When you're hotter, you're sweating, and you're outside all day, it's easier to remember to stay hydrated, and maybe you have more desire to drink water. However, in the colder months, people tend to forget to drink, or they don't feel as thirsty, or they're not as conscious of hydrating themselves. So among the many other consequences of poor hydration, another thing that contributes to is, again, that thicker mucus and congestion, as the mucus really needs water and hydration to thin it out and allow it to flow freely and effectively clear out what the body's trying to clear away. Not only does dehydration lead to decreased flow, which increases susceptibility, it also leads to decreased elimination of toxins because proper hydration supports our elimination of toxins in the body. And just as a reminder, our primary routes of elimination in the body are through the digestive tract, the urinary tract, the integumentary system or the skin, and the respiratory tract. And this part is key, that the body is trying to eliminate toxins from the body. When there is an overburden of toxins in the body has to come back to its normal state of health. It's always trying to come back to a normal, optimal state of health. So when there is an overburden of toxins in the body wants to get that out of the body through these routes of elimination and other means. And this is one of those key factors that contribute to our susceptibility to illness or uncomfortable symptoms overall. So where do we get these toxins? Well, we can get them from the environment, from different pathogens in the air. We can get them from the home, especially in the colder months if we are not exposed to nature as much. Not only are we not getting enough vitamin D, but we're not getting enough exposure to fresh air and the natural elements that tend to keep us well and that our bodies rely on and we're meant to be integrated with to keep us in a balanced and healthy state. So if we have a situation where we are tending to stay inside most of the time, coupled with using a lot of chemical scented products or chemical cleaning products that we're inhaling throughout the day, our indoor air quality is not as great. It's usually far more polluted than outdoor air quality. And in addition to that, you think about the holidays and people lighting scented candles. And depending on what kind of candles these are, this can also contribute to more of the household toxins in the body that we are breathing in through the respiratory tract. In addition to that, we have dietary sources of toxins. So we talked about ultra-processed foods, high sugar intake, but also we tend to indulge, right, during these holiday months. And when we tend to consume, for example, our food intolerances, so these may be foods that you are aware or even unaware that you're intolerant to, but anytime you consume a food that you are intolerant to, for example, this means your body lacks the ability to break it down properly and use it for nutrition and fuel. And so what happens then is it just sits and rots and putrefies in the gut as it's passing through. And this creates toxins that then enter the bloodstream and contribute to systemic inflammation and tend to circulate and affect you negatively in areas where you're most susceptible to. So for someone that might be the nervous system, for someone else that might be the cardiovascular system or the respiratory system. So it all depends on personal susceptibility as well. The point here is that, yes, there are even dietary sources that can contribute to systemic inflammation that increase the body's overall toxic burden that it is trying to then deal with in some way to try to get these toxins out of the body. And this can lead to more susceptibility to symptoms of a common cold, again, as the body is trying to wisely eliminate some of those toxins out of the body through different means. So to wrap up in this video, we looked at some of the reasons why we get the symptoms of the common cold. And I hope you're beginning to see that from a terrain theory perspective, that getting colds and the symptoms of a cold is a wise adaptive response to the body to try to deal with an overburden of toxins and try to bring the body back into a state of normal and optimal health for you. Understanding this also helps us to try to prevent being overcome by colds in the future as we learn to try to reduce our susceptibility or engage in habits that can keep us more resilient and keep our immune system strong. And most importantly, the importance of supporting colds when they appear and not suppressing them as we typically do in a conventional care model. Now, we're going to cover that in the next video, all about supporting versus suppressing or treating colds, and as we tend to be familiar with it. But in this video, we talked about some of the causes of the common cold. We talked about the cold air, the seasonal changes, less vitamin D from sunlight exposure, more dehydration, the high sugar holidays that contribute to a weakened immune response as well, and just an accumulation of toxins, whether that's from environmental pollutants or some of the products that we're using at home and inside, and how even some dietary factors can contribute to systemic inflammation, which then overburden the body and our elimination pathways and can cause more stress on the respiratory system as well. Don't forget to subscribe to the channel to be notified about when that next video comes out about how to support and not suppress cold symptoms, and overall how to keep your family healthy and well. I'm Dr. Jinmee Graham, and I'll see you in the next video.